The Children's Dental Health Project is now a 13-year-old independent nonprofit advocacy organization that represents the interests of underserved children and seeks to improve their access to oral health, both oral health and oral health care, through public policy. I had the opportunity in 1997 to work on Capitol Hill as a staffer for Senator Tom Daschle, who was minority leader at the time, through the Robert Wood Johnson Health Policy Fellowship. During that period, the first CHIP bill, the Child Health Insurance Program, was enacted. As a pediatric dentist, I was always aware that the congressional attention to children's oral health was modest at best. The legislation did not follow the prior experience of mandating dental services as had been done in Medicaid, and it left children potentially without coverage because the option was given to states regarding the extension of services to dental care for children. So we founded the Children's Dental Health Project in order to first work with the states to implement the dental benefit that was then allowable to them in CHIP, and then to expand our mission to addressing children's interests, children's oral health interests throughout public policy. The issue of children's oral health, or oral health for all vulnerable and socially vulnerable populations, is one of terrific concern to the Santa Fe group and terrific concern to the attendees at this conference. In fact, the fundamental issue is a lack of understanding by senior policymakers about the importance of oral health per se, or the integration of oral health within somatic health. There are political ramifications as well as policy ramifications in determining whether or not oral health provisions will appear in healthcare reform. I'm pleased to report that, as with the reauthorization of the CHIP legislation, which was signed by President Obama on February 4th, the healthcare reform, too, is full of robust provisions on oral health, but sadly limited to children's oral health. Congress has come to understand the importance of oral health for children and has integrated the concept of oral health along with vision coverage in child coverage, but has not yet come to appreciate and fully understand the importance of oral health more generally. Our efforts, although we are the Children's Dental Health Project and our focus is vulnerable children, our efforts to represent the interests of frail elders, of adults, of pregnant women, of particularly poor adults, have not fared well in our work with senior policymakers. The Children's Dental Health Project is primarily focused internal to the Beltway. Our primary audience are the members of the U.S. Congress and the federal agencies, and we are significantly unknown outside of the immediate environment. However, the Children's Dental Health Project has recently been designated as the National Oral Health Policy Center by the Maternal and Child Health Bureau. We are engaged in a cooperative agreement with CDC, providing specific oral health policy support to 17 states, and our website, www.cdhp.org, provides extensive information for advocates that they can apply whether at the federal, state, or local level. When you ask about oral health provisions in healthcare reform, I'm happy to report that the Children's Dental Health Project and others who we've worked with have succeeded in obtaining quite a number of provisions. The most significant is that there is now, for the first time in this arena, the mandate that children receive dental coverage as part of qualified health coverage. So any new coverage offered through healthcare reform will require dental services to be included. There are a number of other provisions that relate both to healthcare reform and were instituted in the earlier child health insurance reform that deal with workforce, with quality, with Medicaid reform, with education, with prevention. So both the CHIP bill, the reauthorization bill that was signed February 4th by the President, and the healthcare reform address oral health in a variety of ways. But there are some serious missing components as well. And perhaps the most important missing component is the failure of Congress to appreciate the importance of oral health for adults as well as for children. In particular for frail adults, for vulnerable adults, for low-income adults. And the legislation currently is completely bare of any attention to adult oral health. This is an issue that goes far beyond healthcare reform, because healthcare reform is one step in a series of ongoing efforts to bring the mouth back into the body and to address significant concerns for adults. We are particularly disappointed that Congress did not respond to our call for at least coverage of the emergency relief of pain and infection should it occur in the oral cavity rather than any other part of the body. Within the context of the current legislation, because adult dental coverage is not included, and there would be some structural issues in trying to include it because of the nature of dental insurance versus the nature of medical insurance. But nonetheless, the failure to incorporate the oral cavity into, or care of the oral cavity into healthcare reform. The diabetic who has a periodontal issue does not have coverage as required under the current provisions in the healthcare reform. The only traction that has been gained so far in adults is an amendment by Congresswoman DeGette of Colorado, who has called upon the Secretary of Health and Human Services to report to Congress about the consequences of not covering adult oral health. Even that provision, which was accepted at the committee level, now in the full House bill, which is only one bill along the way to the final bill, even that provision was watered down and was changed from a mandatory report to a suggestion from the Secretary. And we don't know if that provision will survive or perhaps be strengthened as the legislation continues. The one thing that I can say as of February 16th is that whatever we have now is bound to change. And there is a tremendous effort underway by the Children's Dental Health Project and our colleagues in the child health community to retain the provisions that have been secured and to strengthen them wherever possible. The Children's Dental Health Project, although not a grassroots membership organization, but a freestanding independent organization, certainly welcomes all inquiries and provides a great deal of information on its website for oral health advocates. The website is cdhp.org. The organization is located in Washington and can be reached at 202-833-8288. And the staff of 7 stand ready to provide any kind of assistance, as well as to learn from people in the field who are involved in advancing oral health, any new techniques or efforts or synergies that might be built.